Hello, everyone. I appreciate you being with me, and I appreciate that we'll take a few minutes here and we'll go through some comments that I have, and then we'll pass along questions to the media in regard to the income tax, and then if you'll allow us to just break just a few minutes, and then we'll go right into our COVID briefing. But I didn't want to commingle the two, because I truly have said over and over and over that I think with all in me that the most important issue that this state has ever had in its entire existence in front of them is in front of us right now. And that's the personal income tax situation and the ability to get our state moving and get our state growing. And I'll get into all that in just one second. Before I go there, I want to just say just this, that through all this process, the one thing that is just not acceptable to me in any way is behavior that happened not long ago when the House viewed an issue one way, the Senate viewed the issue another way. They came into conference with one another, and what happened? A bunch of semi out of control. I mean, it's been told to me over and over and over. It mimicked the look of a mob in our state capitol. It mimicked the look of a mob. And then, you had a delegate, and possibly others, but a delegate, Joe Jeffries from Putnam County, I think, and he got up screaming obscenities like you can't imagine, honest to God, in our Capitol. I mean, a delegate. I mean, it is just unthinkable that we have gotten to that level. And so today, I am calling upon Speaker Hanshaw to require, not ask, require Delegate Jeffries to make a public apology to these senators, and that is Senator Trump, Senator Clemens, all of the senators, and Senator Pastor Stephen Baldwin. It is absolutely just vulgar. It is disrespecting the great House that we're in every way. It is comments that should have zero tolerance, and this man should either be kicked out of the House, period, or he should absolutely be told that he has to make a public apology to these great people, because that behavior is absolutely intolerable. That's all there is to it. It should be, absolutely never should we dip to that level. Now, these remarks, just came to me not long ago, but I understand now that one of the senators, Mike Wolfel, has spoken about this, but it is a shame. It is a crying shame. That's all there is to it. You've got people that can get out of control. You saw what happened with our nation's capital, and absolutely, that is absolutely, totally unacceptable. Just like this is unacceptable. Now, I've got lots of stuff today, and the primary, hands down, is the personal income tax. Now, I want to tell you the story, and I want to just listen. I want you to just listen and go back to piece by piece, because West Virginia, I love you, and I mean it. I love the great people of this state more than good sense. And there's no way on God's earth that I'm going to do anything but tell you the truth. Now, I met over and over and over with the leaders from the standpoint of our so-called supermajorities. And basically, we agreed. I mean, we didn't think about it. We agreed. It was even brought to my attention that, we'll run this on the House side, or we'll run this on the Senate side. Basically, what we all discussed and everything, and then I went to the state of the state, and I brought you an income tax repeal at the state of the state. Now, I'm going to tell you without any question whatsoever, one of these great bodies absolutely kept their word and their commitment in what we were doing. I will never forget until I die, Craig Blair sitting with me just a matter of a couple days ago and talking about the value of honor and truth, because I truly love it. And he absolutely does exactly the same. I congratulate the Senate in every way possible for what they've done. And what did we do? We worked together and we bent. And the House was absolutely always involved just as well. We bent. We absolutely worked together. We compromised. We absolutely know, without any doubt in all the world, the value of this personal income tax to the state and to our people in every way. Now, what's happened now is you have the governor of the state of West Virginia. Surely to God above, that's an important office. And you have the Senate of the great state of West Virginia, and surely to God above, that's an important body in this building. And both of us are in agreement, and now the bill is on the way or already been delivered to the House. And you know what the House is going to do? They're going to table it. They're not even going to vote on it. They're not going to vote on it because they're afraid to vote on it, because certain people will go on the record as saying stuff. They aren't even going to vote on the most important thing that this state has ever had in front of it. Now, I'm going to tell you, that's some really bad stuff. That's all there is to it. It's just plain rotten to the core. Now, yesterday, one of the items that was brought up by the speaker, he said, well, the reason we're really going to table this is because, we really don't understand and know the situation about the growth that you have in the bill of $80 million, of which our revenue department, Mark Mukow, who's been here for 500 years, says that's the most conservative number that there could possibly be. Did you know what we did? We went right up to the Senate and asked the Senate if they would concur. We'll take it out. We'll completely take it out. In other words, we won't put in anything for growth. And let's go back to the speaker and see if we take that out, as he said that was their problem, we'll take it out. Just like weeks before, the speaker said to me, I think our number one problem is the property tax. And we took it out. So we went back to the speaker and we said, Mr. Speaker, we'll take the growth number completely out. And then you go ahead and run this. Well, I knew what the answer was going to be. I knew the answer would be this. And now I'm being ridiculous to make my point. No, we can't run it. No. Now, if you can we don't like it now because it's typed. But if we could have Thomas Jefferson come back to life and he could write this out longhand, maybe we'll consider it. Now, I'm being ridiculous to make my point. But really and truly, that's what we're dealing with here. That's the situation that's going on here. You have somebody spouting out vulgarities like you can't imagine, and it goes, and we accept it. I mean, why in the world hasn't this already been acted on? Why in the world do we let things like this go? Now, I want to read a couple things to you. When I started down the PIT path, here's the primary reasons. People are looking for a place to move and work remotely. West Virginia is a great place to work remotely. We are investing in broadband and roads right today. We have led the nation in our COVID response. People are realizing West Virginia is a safe, beautiful place to live. Now's our moment. Now's our moment. The people that are telling you that this proposal is too big of a change for West Virginia are the same very people who won their seats into office by promising that they would be the ones to bring you change and prosperity. Now just think. In 2014, the House of Delegates flipped to Republican control for the first time in more than 80 years. How did they do that? In the run-up to the election, many of those Republican candidates were saying just this: Democrats have been in control for over 80 years, and look where they've gotten us. We've lost jobs, population, money. It's time for things to change. Isn't that just what they said? Democrats have been in control for over 80 years, and look what they've gotten us. We've lost jobs, population, and money. Isn't it time for us to change? Elect me. Now, isn't that what was said over and over and over? And you know, I agree with that. I agree completely with that. But you know what's unfortunate? That is exactly what they're doing today. Isn't it time for us to change? We've lost jobs, we've lost population, and we've lost money. That's exactly the whole scenario all put together. Now, we do have to change, or we have to settle for what has been at play for decades and decades and decades. If I were a Republican, and if I were in the supermajority, and I truly am a Republican, but if I were in the supermajority, I'll be dogged if I would sit and say, we're not even going to take it up. We're not even taking it up. We want to stay right where we're at. We want to stay dead last in population growth and be that way forevermore. Now, they've also let the lobbyists and the special interest rule the roost. They have. That's all there is to it. We took out the beer, wine, and liquor. We took out the soda tax. Really and truly, the coal and the gas contribution is zero. Zero, and it could grow into something if things were phenomenally good. But like it or not like it, the special interest and the lobbyists with their money ruled the day again. And today, a lot of the reason we won't take it up is just that. This is the biggest chance our legislature has had to deliver on a promise of change. But now that moment is here, and they're shrinking to the occasion. But the Senate did not shrink, did it? The Senate spoke up. And the Senate spoke for the good of West Virginia. Again, I commend all those in the Senate, for all the great work that they did. They tried really hard. I tried really, really hard. Today is very disappointing. There's no question it's very disappointing. The other thing that I tried to do is just this. I got on board. Perspective, maybe not only who they are, but just think about this. The people on board Republicans through and through, past President Bill Cole, past President Mitch Carmichael, and the gubernatorial candidate that I ran against in the Republican primary, Woody Thrasher, all on board 1,000%. 1,000%. And we won't even take it up and vote on it. Now we've got a real disconnect, a major, major disconnect. Now one thing I want to clear up too is the householder bill. The householder bill that Eric Householder's been out saying that it's living proof. It's living proof that if we had to do rebates and everything, that this thing was going to hurt the poor and all that kind of stuff. Gosh, you know, it's just overwhelming to me. It's overwhelming in all kinds of ways. You know, Eric Householder's an intelligent man. He knows better than what he's saying. You know, without any question, this, by what we did, how in the world do you expect a family that is not paying an income tax, how do you expect them, no matter if you increased 1 cent on bubble gum, how do you expect them to be able to pay for that 1 cent on bubble gum if they're not paying an income tax and all you did was reduce their income tax? How do you expect them to do that? The only way we could do that is the rebate checks for the people, the low-income earners that were really struggling. That's what we did. Again, just look back at the householder deal. Look at the influence of lobbyists in his campaigns. Look at really and truly what is going on, and look at Secretary Dave Hardy's comment that in his plan, he continues to cut the poor and the services for our seniors and everybody, and who knows what else. But at the end of the day, the only way you can get there over 12 years, the only way you can get there is with absolute severe cuts all the way through. And at the end, the magnitude of the cuts totaled $3 billion. Absolutely, as you go, they just get bigger and bigger and bigger and bigger. And at that time, you don't even have a government. For crying out loud, you don't have anything. Who knows? Are we going to just cut our seniors and throw them to the wayside? Are we going to cut the people that are struggling the most and just throw them away with all of our services to them? Are we going to cut into Medicaid? What are we going to do? What are we going to do? But we didn't have to do any of this. That's my very point. We did not have to do one bit of it. Now, I'm telling you again, I congratulate the Senate, and absolutely they worked hard because they know how good this could be for West Virginia. Now, I'm not going to quit. There's no way I'm going to quit. I'm not going to roll over. We made real progress with the Senate. You have 2/3 of the government down here saying this is what we ought to do, and the other third says we won't even vote. But 2/3 of the government down here believe wholeheartedly that this is what West Virginia should do. So, I think we've made real progress to have 2/3. We made real progress working together with one another. And so now, I'll go on the road. I'll go on the road, I'll go right to their neighborhoods, and I'll go absolutely every place I can go, and I will tell the people, and I will educate the people, and tell the people with all in me that this is what we lost. This is what you lost. West Virginia. West Virginia, just stay with me just 1 second. I do truly believe that if we continue to work, and we continue to be open, and I'll keep my door open 24/7, and absolutely I'll meet with any legislatures from the House, and I will meet with any of the delegates at any point in time. I'll go over, I'll try with all in me to dismiss misunderstandings or dismiss, or add to education, about what we're trying to do in West Virginia. And at some point in time down the road, if I can see that we have made that progress and we are in a position, then I will call a special session for us to come back on the PIT. I am not going to back away. There's no possibility that I'm going to do that, and because it's just too important. Now, that's all there is to that. Now, let me just tell you real quickly just this. And by what I mean by my road show, last time around on the Roads to Prosperity, I went all over this state nonstop. I sat on a stool. I answered question after question after question. I educated the public, and absolutely, at the end of the day, I would hate to absolutely be a delegate that is sitting on their hands today. And the reason I would hate that is because when the people of this great state believe wholeheartedly that you cost them significant money in their pockets, you cost them absolutely significant pay raises in their pockets, I'd hate like crazy to stand on that. I can stand on that 1,000%, because without any question, we made every single person in this state cash positive. And nobody can argue that with me. Nobody can argue that. Now, with all of that, just think about it. In my scenario, now we adjusted it down a little bit, so this number is not going to be 100% correct, but in my scenario, every household in this state, as an average, every single household would have had an additional $1,483. Now just think about that. And what we've said is, we're not even going to vote on it. It's not any good. It's not any good. Also, just think about this. Just think about the message that I said earlier. The world is looking at West Virginia as a place to maybe come to. They would have come. They would have come for sure. Schools would have gotten better. Absolutely, without any question, we would have been able to do more for roads. We would have been able to do more from the standpoint of raising your home value. We would absolutely have done more and more and more with job opportunity like you can't imagine. Absolutely, they would have come. Not only would you have had more money in your pocket, but there would have been more opportunity by the yin-yang. And not only that, there would be more and more prosperity come, and the bottom line is West Virginia would quit losing population and start growing population. Now, can I guarantee that beyond a doubt in the world? Well, I think I could. But I absolutely can't ever just guarantee anything ever. But I can tell you this, we've figured out how to lose. We've figured out how to absolutely lose. We've done it for 70 straight years. We have lost population in West Virginia. Now, as I said a minute ago, I'm not going to go away. I'm not going to back down. Because I absolutely believe with all in me, this is the single biggest and most important thing that this state has as an opportunity right now. Now, let me tell you, and you've got to either believe or not believe. If you believe in any way that I would be out trying to do something and it would hurt families of any level, then you're wrong. There's no way on God's earth I would do that. There's no way. You have been misinformed, and you have been misinformed by people that are absolutely on a mission from God to play some kind of silly politics. And silly was a really nice word. Again, I commend the Senate for being wise. There's a reason why senators are elected to office for 4 years. They're elected to office for 4 years because of their wisdom and everything. And these great people, they decided that this is tremendously important. We work together over hours after hours after hours. I have tried, good gracious sakes of living, I have tried. I looked at Craig Blair 2 days ago and he said, I'm really tired. Really, really, really tired. You could tell he was. He's tried too. And I thank him. I thank all those that have stood up in every way and recognized just how important this is. It is so important. And so with that, I'll take questions now, and I appreciate it. And if I can't, if it's too technical and everything, I need Dave Hardy. I needed him here. Maybe somebody could ask him to come down.
All right, we'll go to questions from members of the media now. The first today from Brendan Tierney with WSAZ.
Good afternoon, Governor. Brendan Tierney with WSAZ News Channel 3 here. When the Senate finally got the most recent version that passed the chamber, it was only given to members about an hour before that session was held to actually vote on the bill. And one of the big concerns that was stated on the floor is that this is an issue that only Alaska has successfully repealed their income tax. It bankrupted the state of Kansas. So do you think you're just trying to push something through too fast, and that's why the House has decided to kind of hold off on things moving into the end of the session? And what are the biggest concerns that you think might be reached here that might find some sort of compromise by time midnight tomorrow night comes around when it comes to making sure small businesses and things like that are not hurt throughout this entire process?
Well, Brendan, and I don't know if you're being influenced by the broadcasters because you're scared to death that the advertising costs, your advertisers now will have to be included in the sales tax. And I don't know if you're influenced by that, but everything you say is there's just no foundation to it. There's no way on earth this could possibly do anything except significantly help small businesses. After you understand that you've got $1 billion that's going back out into the hands of the people, how in the world can it not do anything but help small businesses? If you don't do anything, without any question, and more people end up, the population continues to drop, what's going to happen to our small businesses? Doesn't that absolutely resonate? And from the standpoint of when it came out, we've been talking about this since the cows came home. The House has been talking about it. The Senate's been talking about it. We've been talking about it and talking about it and talking about it. And absolutely what we did in the Senate with the Senate and ourselves is we did just exactly what we should do. We went, we had a summit, we discussed everything, we answered questions, we had all kinds of conversation back and forth. Collaboratively, we came up with an agreement between myself and the Senate, and that's the bill that ran. And so that was an effort between the two of us, and then that bill, has gone over to the House. We've got days, and if the House were working on it and everything, but the House has just decided they're not even going to consider it. There's a heck of a lot of difference between the House saying, well, we need a little bit more time or this or that, versus, well, we're not even going to talk about it.
Thank you, Brendan. Next, we'll go to Junaid Dill with the AP.
Hi, Governor. I'm just wondering, does this close the door now on an income tax cut for this year? And do you have a plan to call a special session potentially? Thank you.
Well, it surely closes the door for now, and I heard the door slam really, really hard when the House said, we're not taking it up. We're not taking it up no matter what, and so I surely don't have a time frame to be able to bring this back to a special session. It'll probably take a little while, because I think what I need to do is a very, very extensive roadshow in which I am educating people, and hopefully that will have some impact on our delegates and everything to reasonably take a look at this and work with us from the Senate and myself side. But I'm telling you, if the thought or the mindset of our delegates is similar to the conduct and the profanity and the vile that went on the other day, they won't listen. And so, and if they don't listen and everything, and we don't really work together and try to educate ourselves together, to try to come up with a plan that is great for West Virginia, then West Virginia will continue to lose population. Our small businesses will continue to be hurt. The lobbyists will continue, and the special interests that are out of state in every way will absolutely continue to rule the day, and shame on us.
All right, thank you, Junaid. Next to Mark Curtis with Nexstar Media.
Good morning, or good afternoon, Governor, and everyone else. In terms of, in the interest of full disclosure, Governor, I am a member of the West Virginia Broadcasters Association. I'm just a rank and file member. I'm not on the board. I'm not in any decision-making capacity. But I do understand the association's argument, and it's about equity. The advertising tax does not tax newspaper advertising. It taxes radio and TV, and it also taxes the radio and TV website advertising within the state. However, it does not tax the big players that come into the state from elsewhere: Facebook, Google, Twitter, etc. And so I think the broadcasters have a question about the fairness and equity in this. Will you sit down with them and meet with their board members and discuss this? And is there any possibility it could be removed from the bill?
I'll sit down, absolutely. I mean, I would welcome it, Mark. I'll sit down and talk with anyone, and we'll work through it, in its entirety. From the standpoint, the Google or whatever people like that were out there, I had them in this, from the standpoint of, but I keep going back to the exact same thing, Mark, and it's just this. And I appreciate you acknowledging that your station is a member of this. But I keep going back to just one thing. Mark, how do you expect to grow? How do you expect to have growth? Do you expect that maybe one of your competitors is going to die away, or you're going to try to rob business from him? How do you expect growth? The population is going down every day, and as the population goes down every day, the amount of advertisers have to go down. They've got to go down. Now, you have a state that's flourishing right now and everything. I'm surely a big part of that. I don't want to ever say I am the part of it, because there's been a lot of great folks that have played great roles in that, and I pass all the accolades, like I said, to the Senate and all the great people that have been around me. But how do you expect growth? I can guarantee you growth. I can guarantee it right here. I can guarantee it one way and one way alone. I'm going to put $1 billion out there in the hands of our people, and advertisers all across this state are going to clamor. They're going to work like crazy to try to get some of that money, and they're going to come to your station and put on TV ads. I can guarantee you growth just like that. You can stick your head in the sand? Absolutely, and good gracious. The amount of ads and of all things, attacking Senator Tarr, I think that's just plain terrible. Just plain terrible. You want to attack somebody, attack me. I mean, for crying out loud, absolutely. Those ads that are running all over the place, again, because maybe you're not charging yourself for your ads, but if you are, you've probably spent $1 million in ads running all across our state by the lobbyists again, by the big out-of-state lobbyists. They're going to spend $1 million, but you know what? They believe that that's going to return them millions and millions for years and years to come. It's a shame. It's a shame.
All right, thanks, Mark. Next to Kenny Bass with WCHS and Fox 11.
Governor, I'm wondering if you're surprised at the way this thing is coming down. I watched your summit with the legislative leaders, and it felt like while you had a dialogue going with the Senate, that you and the House members were kind of talking at each other instead of to each other. I didn't see a whole lot of give and take. I saw a whole lot of give and give. So since that day, this has seemed like it would be the likely outcome of what was going to happen. So how surprised are you that we've arrived here, especially after your interactions at the summit?
I'm not surprised 1 ounce. I mean, honest to Pete, I believe that I could have rolled in with suitcases of money to give to every single person in the state of West Virginia, and the House would say, nah, we don't want to do that. It's just irresponsibility in my book, and the only reason on the planet that we may have been talking at one another, I mean, Kenny, you know me really well, and I have begged and begged and begged. Just please tell me what you want to do. Tell me what you want to do. Oh, we're on board. We're on board. Governor, we're right with you. We're on board and everything. Now, the one thing, Governor, we don't really like is probably, I'm getting the most heartburn, and this was the speaker, I'm getting the most heartburn over the property tax. And I said directly to the speaker at the mansion, let's take it out. Take it completely out. And I did. I took it completely out. And then, Eric Householder comes over and he says, well, really and truly, Governor, I'm having the most trouble with the tax on soda drinks and tobacco. Where's that coming from? That's coming from the lobbyists. That's coming from the lobbyists. The lobbyists that are paying for people's campaigns. They're paying for a reason. That's coming from the lobbyists. Look, Kenny, I've changed every way you could change. All I can say to the people is just this. From my standpoint, absolutely without any question, it's going to save me money to not do this. But from my standpoint, single most important thing in the state of West Virginia, hands down. Shortchanging the people, that's what we've done. We have shortchanged the people beyond belief. I mean, they don't even know it. But if I have my way in time, and it may take me a little while, they will know it. And when they know it, they're not going to be happy campers. They're the ones that vote, and they should be the ones with all the power.
All right, thanks, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering what you hope to accomplish by going back out on the road. As you just said, we've been talking about this for several months. I think we all understand your perspective on the issue and have a good understanding of all the nuances. What else is there to say about this issue?
The people still don't understand, Charles. Once the people really get this, I mean, everybody's busy. I mean, for crying out loud, I spoke recently to a senator that viewed that terrible display up there in the hallways where the people were in conference. And they said, I was really, really upset with that, and it was disgraceful and everything else under the sun, but gosh, we've been so busy. Well, that's just what happens. Today, it doesn't matter. I mean, society has turned in so many ways to, it doesn't really matter what's right and wrong. It matters on what we can get by with. And like it or not like it, but the people of West Virginia are busy. They're busy all the time. And they do not understand what has happened to them here. It is my job to educate them. It is really our legislature's job to educate them. That really is our job. But what we've done for political reasons, whatever it may be, we have hidden things. We have hidden things behind the curtain so that the people won't know, so that we can achieve our political goals and ambitions. That's no good. That's exactly what's happened. But Charles, I would do all in my power to educate them.
All right, thanks, Charles. Next to Todd Boucher with WTAP.
Well, first, I'd like to say hello to my fellow broadcasters. But my question, Governor, Mark Curtis discussed the situation with the broadcasters and the West Virginia Broadcasters Association. But I'd like to ask this. do you see this coming up before the legislature, maybe even next year, if there's no timetable involved with you're calling a special session?
Well, it's possible. I mean, anything and everything, I guess, is possible. But let me just ask. I asked a question to Mark. I'd ask this question back, to you, yourself, and all the broadcasters. It's just this: is again, how do you expect growth? How do you expect any level of growth? There was a real estate guy one time told me, he says, nobody's buying anything, and really and truly, we got to give you a card because I want to make sure you're not a real estate person, because all we're doing is running around trying to sell real estate to other real estate people. Well, I tried so hard for that not to happen. But the biggest thing I'd tell you about coming back next year and giving this another twirl next year is this: two things. It's really hard, and it takes a lot of time and a lot of effort. It's really frustrating, and it's really disappointing. But the biggest thing of all is, do you really believe that the opportunity, the spotlight of the world that's on us right now, will stay here until next year at this time? Do you really believe such a thing? If you believe that, you're living in a cave. Opportunity does not sit around and wait on you forever. It just doesn't do it. Literally, I'm a business guy that's done tons of stuff, and I know when opportunity's there and you can seize that moment of opportunity, you got to move. We've missed it. We've blown a chance for this state like you can't imagine.
All right, thanks, Todd. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, on your Roads to Prosperity tour, you were trying to get a bunch of votes together from the general population. It would seem on this tour that you're going to try to pick off a bunch of delegates somehow in the House of Delegates and try to change their mind. Are you going to challenge them personally during your tour? Are you going to target certain delegates that you believe have been ignorant or irresponsible?
Well, let me tell you, there's three choices in my world. I could just lay down and do nothing. I could just accept what I know is terrible for the state of West Virginia, or I could fight. That's the three choices. Well, I'm not just going to lay down. I really believe that God made me Jim Justice for a reason, and He made me this, so I expected me not to lay down. And the other thing is, I'm not going to just accept something that I know is wrong. I'm not going to do that. So I'm going to fight. And absolutely, if it means challenging, folks that I feel like are doing the wrong stuff, yeah. Absolutely, I'll be right there, and I'll be glad to debate it with anyone at any time. What has been promoted over and over and over is scaring people, the dark of the closet. It is, and Paul, I think the question was Paul, but Paul, just think just this simply. You have all of the tax people of the Department of the state of West Virginia, and they know unequivocally that absolutely my demands are, you got to make this to where everybody across the board ends up with more money in their pocket than they have in their pocket today. After any increase, everybody, all the way across the board. And what do? They come back and say, we have achieved just that, and here's what we've done. We've modeled and modeled and modeled and modeled, and here it is. Now, and basically it's just simply this, Paul, is think of Alpha. Think of the Murray enterprises that are working today? How many thousands of people do they employ? How can they look right at their employees and say, we weren't supportive, we really weren't supportive of every one of you getting a $2,000 pay raise? Now, Murray came on board, you know, and I appreciate them, or the ex-Murray, you know, folks. But how could they look right at their employees and say, no matter what company it was, saying we didn't support this, and Dave Hardy and Mark Mukow are saying every last one of those employees would have been able to take home to their families right at, you know, probably $1,500 to $2,000 of extra money after all their taxes they paid on a higher sales tax or whatever, cigarettes or whatever. How do you look at your employees and say, oh, well, we just decided to poop on you? You know, I don't know how you do that. You know, and so absolutely, Paul, I'll be out there and I'll be talking to all these people. And if it, I mean, Paul, it may take 2 years and it may take 30 days, you know, but I'll be soliciting help from Bill Cole, Woody Thrasher, Mitch Carmichael, all the leadership on the Republican side, probably people that may very well think about running for governor after I'm gone, you know, and I'll be out there working with the Senate and Craig Blair and the leaders of the Senate and everything, and there may be some of them that are looking at the possibilities of running for governor, but I'm not running again. All I'm going to do is be out there telling the people exactly what it is. And at the end of the day, you know, what we may very well happen is you've got a supermajority of Republicans right now that really became a supermajority because when it started, because they were saying the Democrats sat around and didn't do anything to really make change. Well, the Senate's trying. The Senate's really trying, and the House won't even vote. You know, tell me how that works.
All right, thanks, Paul. Governor, I'll turn it back to you to close out this briefing.
No, if we got any other questions, I think we're done. But again, I appreciate you being on. I'm sorry this is drug on and everything, and we're late on the COVID stuff. But you know, what a disappointment. But it doesn't mean that we didn't make progress. It doesn't mean that we don't go forward, and we absolutely go on the road and we convince and talk to the people, and the people will decide who they want as their delegates. You know, and like I said, if it takes a couple of years, the people will decide about these delegates. That's all there is to it. You know, and so with all that and everything, most important issue that we have ever addressed in this state, it's dead, and I thought you needed to know that. And from the standpoint of conduct, I hope to goodness that Joe Jeffries will stand up in front of everybody and say, boy, did I really screw up, and I'm sorry, because these great people that was directed at, Charlie Trump, Senator Clemens, and Senator Baldwin, they're too good of people in our Senate to be having that level of conduct. In fact, that level of conduct is should never be tolerated. Anyway, thank you all a bunch. We're going to do the briefing on COVID in just a second, and thank you. And like I said, big disappointment, but it's over. Thank you.
A reminder to members of the public watching today and members of the media participating, the governor's regular Friday COVID-19 briefing will be held on the same live stream link following a short intermission. Please stay tuned.
hello everyone. We're late on the briefing. We just did a thing on the personal income tax, and very regretfully, it's a dead item. Again, I thank the Senate for all that they've done, and 2/3 of the government, the Senate and the governorship and everything, all in, and the House won't even vote on it. So it's disappointing, but that's what we got to live with. Anyway, we've had 15 additional deaths in West Virginia. I hate that like crazy, and the trend still is good, but we've gotten 3 red counties now in the state, and we just got to continue to be on guard. Or I'm just going to be able to sit here every day, of which I hate like crazy, to sit here and read names, not necessarily names, but the numbers and the people, the counties, their sex, their age of people that we've lost. And, if we don't get vaccinated and we don't continue to wear a mask and be cautious in every way, washing our hands and keeping our distance and everything, all you got to do is watch. All you got to do is watch what I'm going to have to do day after day after day, and that is sit here and read to you the people that we've lost. Great West Virginians, could be you, and absolutely with all in that, great people that these people's families and loved ones are hurting, and it's a shame, and I hate it. I hate it so badly. Our 2,723rd death is an 86-year-old female from Morgan County. Our 2,724th death is a 71-year-old male from Marshall County. Our 2,725th death is an 84-year-old male from Morgan County. Our 2,726th death is a 71-year-old female from Harrison County. Our 2,727th death is a 67-year-old female from Putnam County. Our 2,728th death is a 91-year-old male from Barber County. Our 2,729th death is a 62-year-old female from Ohio County. Our 2,730th death is a 76-year-old female from Putnam County. Our 2,731st death is a 49-year-old female from Berkeley County. Our 2,732nd death is an 83-year-old female from Grant County. Our 2,733rd death is an 81-year-old female from Harrison County. Our 2,734th death is an 82-year-old female from Putnam County. Our 2,735th death is an 81-year-old female from Pendleton County. Our 2,736th death is a 62-year-old male from Brooke County. And our 2,737th death in West Virginia is a 73-year-old female from Nicholas County. Just imagine 2,737 great West Virginians we've lost. Please, please keep them in your prayers. Some way, somehow, they'll be able to feel your prayers and to feel that they're not alone. Please, please do that. We have 479 new cases in the last 24 hours and a positivity rate of 3.70. We have dropped to 5.23 in our cumulative rate. We have 7,084 active cases and 135,000 and change recovered. We have 280 patients now in our hospitals and 87 in the ICU units, with 3 red counties, Boone, Raleigh, and Berkeley County. Again, I remind you, if you're 65 years of age, you cannot possibly sit there and hear me calling names day after day. And if you get a cold, a sniffle, a headache, tiredness, anxiety, go get a test. Just go get a test. If by chance you were positive, we catch it early enough, the antibodies will save your life, and absolutely, we think that in every way. And if you don't, you're in for a tough go. That's all there is to it. The other thing is, we just found out that in Berkeley County, we now have a confirmed case of the South African variant. It is more and more and more testimony that now it's in 36 states across our nation, but now it is in West Virginia, And Dr. Marsh and Dr. Amjad will tell you more about this, but this is an extremely transmittable variant, and so it is really important to stand up, and absolutely super important to stand up about wearing your mask. The vaccine eligibility is all up there, 16 and above. And to young people today, I am again calling upon all West Virginians. Now you got to help me, West Virginia. I did this on Wednesday. But I'm calling on the parents and the grandparents to step up and tell your children, ages 16 to 35 years of age, we have got to get you vaccinated. We have got to get you vaccinated and get you vaccinated as quickly as possible. Not only could it save real sickness, maybe death, but young people can absolutely, with a life of decades and decades in front of them, they can be harmed possibly with side effects, heart or whatever it may be. We have got to get you vaccinated from the standpoint that you are the people that are transmitting this faster than anyone else. On a vaccine distribution update, yay, West Virginia, great job. We now have in the arms of West Virginians in excess of 1 million doses, 1,056,510 doses in the state of West Virginia, 645,000 first doses, 433,000 second doses, and that's a change and everything, and so that's great stuff. From the standpoint of saving our wisdom, we have now 65 years of age and older. We have now put in ours 254,000 doses, and in that there's 210,000 that are now fully vaccinated. We are over 75%. Unbelievable. Way to go. We're on our way to 85. We absolutely set a goal in the beginning to try to get to 70 or 75. I said, no, we're going to fly by that and everything. We're going to absolutely keep going. We got to absolutely get to 85 plus. On the manufacturing stuff and everything, we can go to businesses, we can go to churches, we can go to ball teams, we can go to schools, we can go to all. We are begging people to give us arms to put these shots in. It will save all kinds of lives and everything. And all we ask that you do is reach out to the numbers that you've seen and get in touch with us, and we'll schedule it all. And we'll come to your church, whether it's a church pastor that reaches out, we'll come to your business, we'll come to your school, we'll come to your ball team, whatever it may be, we'll come and try to take care of you as quickly as we possibly can. The vaccine info line is all up, vaccine reminders. You've got to take your vaccine. I keep telling people, for crying out loud, just please listen to me. The side effects are almost nothing. The absolute chance of you getting one of these variants, or absolutely getting this dreaded disease, and then having I don't know how to say it, but other than just hell to pay. That's all there is to it. If you happen to be especially an elderly person and you get this and you don't get the antibodies early enough, you're in real trouble. And life is going to be really, really bad. Really bad. So as far as our free testing, it's available, it's easy, it's nothing to do. We thank Fruits, we thank Walgreens. As far as the outbreaks, we've got 8 long-term care facility outbreaks. We've got 7 outbreaks in our churches in 6 counties. Those counties are Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh counties. We have 97 inmate cases now and 9 staff cases, 36 at the Southern Regional Jail, 34 at Salem Correctional Center, and 23 at South Central Regional. Guidelines, I tell you over and over and over, they're all up. Wear your face mask. Don't just absolutely start running with the bulls and forget your face mask. We're not through this, but we're close. I don't know how many times I've got to tell you, I can't stand these things, but these are lifesavers. If you believe the contrary, you're going right in the face and defying what our CDC, Center of Disease Control, what our government in every way, what President Trump told you over and over before he left office, absolutely what our super experts, our coronavirus czar, Dr. Marsh, everybody is telling us and advising me, you got to wear your mask. Please consider giving blood. And now I've got to report one thing that's really tough. We lost a firefighter. We lost another one of our brave first responders in the line of duty this week. On Easter Sunday, the Albright Volunteer Fire Department in Preston County responded to a wildland fire in Preston County. Albright Captain Charles Wesley Chuck Miller answered the call. Captain Miller was driving to the fire to assist when it is believed a possible medical emergency caused him to lose control of his vehicle. Captain Miller, 62 years of age, had been a firefighter with the Albright VFD for nearly 30 years. He is survived by his wife, Carrie, their 2 sons, a grandson, and other family members. Kathy and I send our deepest condolences to his family and loved ones of all those that are friends and family of the Albright family or the Albright community. Now, let me just say just this. We always take time to recognize those that we've lost. But this gentleman here gave so much, 30 years protecting and looking after his community. A great community in the state of West Virginia. We can never thank him enough. We can never thank the family enough. And great goodness alive, I know he'll really be missed. So, God be with him and all this great family, please. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
That we are in a new part of this COVID-19 pandemic response in West Virginia and in our country. And as we look at our strategy, there's really 3 different parts of our strategy that are connected now. And the first part is, as we've done from the very beginning of our pandemic response, we focus on saving lives and reducing hospitalizations. And that means we target our over 65-year-old population, which accounts for a majority of the deaths that we see from COVID-19 infection, our over 50-year-old population, which is what accounts for the age grouping for 97% of our deaths, and our nursing home and long-term care facility, as well as assisted living population that accounted before our vaccines for about 50% of our deaths. So we continue to try to expand the number of vaccines, because as we hear the governor read the names of West Virginia who have died, it is in this group that we still see way too many deaths in the citizenry of our state. The second front that we are approaching strategically is our younger people. As we've said many times with these variant viruses, and now that we've found the South African variant in West Virginia, as well as we see growth of the United Kingdom variant in West Virginia, we recognize that these variants are more infectious, can spread easier, and we see the spread of infection mainly in our younger population. So as we work to really focus on helping younger people be protected from the impact of COVID-19, which has these new variants are perhaps more severe for even young people that are generally have been felt to be protected against these consequences of COVID-19, including being sick enough to be hospitalized. And also that we know that these folks spread the virus, and that accelerates the spread of virus in our state. So we're really focusing on trying to help these young people and their families choose to get vaccinated to protect themselves and to protect each other, as well as to protect the populace of West Virginia. And we know that particularly on sports teams and extracurricular events, that this virus is spreading more rapidly. So the benefits of getting immunization for the COVID-19 virus include the ability to continue to play sports, to stay healthy, to not have to quarantine. Today, if one person on a team gets sick, then everybody needs to sit out who's been connected with each other. But in a fully vaccinated population, that is no longer necessary. So I think for the safety of our children, and also for the ability to continue to reduce the spread of COVID-19 and these variants in West Virginia, it is really, really important that through our school systems and our Higher Education Policy Commission and with younger West Virginians that we see this population choose to be vaccinated, which really will help us buy more time, because the third focus is that we need to vaccinate all of our population, that we know that the older part of our population is dying more commonly from being infected with COVID-19. Our younger part of our population is spreading COVID-19 more quickly, but it is the rest of our population that is also at risk for developing long-term effects of COVID-19, being hospitalized or dying. And so the more people we can immunize, the better. The country of Israel has immunized about 2/3 of their population. And what they've seen today, they went from about 7,200 cases on average a week in January to now 300 or 350 or so cases per week that they've seen in this current week. But almost all of their deaths are in people that are not vaccinated or who are not fully vaccinated. And that means they're 2 weeks or less from that first dose of vaccine, because we know it takes at least 2 weeks to get the immune response. So learning from other countries really gives us insight for West Virginia, which says for all of the right reasons for us to continue our leadership position, but more importantly, for us to continue to be able to save lives, reduce long-term impact of COVID-19, and to reduce the spread of new variants that offer many more problems in the rapidity of spread and the severity of disease, then we all need to work together to make West Virginia the place that reaches its potential and continues to be the beacon for the rest of the country and even the rest of the world to see. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. We've implemented some additional changes to the COVID-19 dashboard. We're now including statewide immunization information system data. This is to be more consistent and in line with CDC reporting. Doses administered will include doses that the state receives and doses administered to the federal pharmacy and the FQHC programs. We have not had direct access to that information in the past. Doses received will only include total doses received, including doses that have been received through the federal pharmacy and the FQHC program. We can't separate the federal pharmacy and the federal FQHC allocations by first and second doses. So please understand we're using the best data we can to be fully transparent with you. Partially vaccinated will change to people receiving at least one dose in alignment with the CDC measure. This will include the total number of people who received at least one dose of the Pfizer or Moderna COVID-19 vaccine, and the total number of people who received a single dose of the Johnson & Johnson's COVID-19 vaccine. Fully vaccinated will stay the same, and the data that is included in the metric will not change. This is also in alignment with CDC measures. Johnson & Johnson doses administered will be counted in both people receiving at least one dose and people fully vaccinated. There's actually a yellow tab that will now on the vaccine summary tab that will give you additional information and definitions for those. So again, those changes are to try to continue to be transparent and provide as much information as we can to the public. Thank you.
Thank you, Secretary. Dr. Aina Amjad, our State Health Officer, and retired Major General Jim Hoyer, Director of the Joint Interagency Task Force, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
All right. Good afternoon, Governor. Good afternoon to everyone. We appreciate your time as always. It's now been about 10 days since the electronic death reporting system was implemented. I'm wondering how that's working. Are you satisfied that it's working as envisioned? And with the new variant showing up in Berkeley County, can we be assured that the current vaccines, all three of them actually, are effective against it? Thank you.
Okay, Dr. Amjad, maybe you can take this. Mark, I do not think that it's completely up and going and been implemented yet, but I could be wrong.
Sure, Mark. So the governor's right. We are still looking into different vendors and looking into that. It does take some time, the electronic death reporting system, but we are aggressively looking into that to implement something rather quickly, but it does take some time. And to answer your second question, and Clay might want to add to it, the vaccines that we do have right now are, they do work against the UK variant and the California variant. As far as the South African variant, I do believe it is effective if you have the 2 doses of the Pfizer one. The Moderna and the J&J, I'm not sure if there's any new data out there, Clay. I do know the Pfizer vaccine is for the South African variant.
Yes, thank you, Ayn. And just to add on to what Dr. Amjad said, that all 3 vaccines, when used in real-world circumstance, have demonstrated effectiveness in protecting people from hospitalization and death. We do know, however, that in a laboratory setting, because of a particular mutation in the South African variant, that native antibody production, so people that have just recovered from COVID-19 with no vaccination, may not have as good a protection longer term. And so that's the reason why we recommend everybody, even if you've had COVID-19, to get vaccinated afterwards so that you will have that protection. And in addition, the vaccine manufacturing companies are continuing to anticipate that these viruses will continue to mutate and to continue to have more ability to infect easier and perhaps have more lethality for people. So they are constantly upgrading their vaccines as well, which is a benefit of these messenger RNA vaccines that are produced by Pfizer and Moderna, so that if a new mutant comes that is more resistant, that we can revaccinate people potentially against that variant as part of our strategies.
All right, thank you, Mark. Next to Katie Coyne with the Charleston Gazette-Mail.
Thanks for taking this. Governor, you're talking about how we have in excess of over 1 million doses given. There are still counties that have not vaccinated a single Black person. In some counties, the rates of vaccinations among the Black population isn't even comparable to the vaccination rates among the white population. We're months into this. How are we dealing with this now, and where do we change gears here to make sure that we are getting more minorities vaccinated?
Well, if I could start, if that be the case, I have no knowledge whatsoever, and I would really question that as being credible information. But General Hoyer, maybe you could answer that, please.
Yes, Governor. Katie, as you have heard before, DHHR has a very significant outreach with the African American community and other minority groups. And we are working aggressively with a variety of groups to continue to address access to vaccines, but primarily vaccine hesitancy initiatives. You do have some small counties that have very small minority populations that we continue to work with local health departments. So I would categorize, from my perspective, that West Virginia is doing an aggressive outreach to address populations, all populations, and we will continue to work hard to make sure that we address the challenges that we and other states across the country have with getting to minority populations.
All right, thank you, Katie. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if now that we're starting to see more of these variant cases pop up and we now have, multiple variants in the state, is there any plans to add some way of tracking those and keeping track of it to the DHHR dashboard? Thank you.
I think maybe Bill Crouch could answer this, please.
Yes, sir, Governor. Thank you, Charles. That's an interesting point. We have not contemplated really tracking that on the dashboard. We do keep that information and follow that information, and our epidemiologists, especially our state epidemiologists, tracks those cases. We're doing more and more sequencing so that we make sure we identify as many of those individuals as we can. But it's a good suggestion, something we need to take a look at, and I'll make sure we push that forward and see if that's possible. Thank you.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
And a question for General Hoyer, going back to distribution of vaccines. General, I know there was a lot of talk several weeks ago about homebound patients and getting the vaccine to probably one of the most difficult populations because you have to deliver it rather than them coming to you. What progress have you guys made on a plan? Has it already been implemented? Are you moving forward? And does it by chance include the Johnson & Johnson vaccine, which would make it more convenient because you only, of course, have to make one trip to your destinations? Thank you.
General, please go.
Yes, sir, Governor. Yep, Kenny, there are several initiatives going on, as we mentioned in an earlier press conference, working with senior services to identify homebound population that are served. As we also mentioned, those family members or neighbors that know of homebound individuals that have not been served yet, if they will please reach out to our hotline and give us that information. That goes to our interagency task force that then coordinates directly with local health departments to identify whether it's a pharmacist or one of the mobile capabilities that we now have stood up with the National Guard or some other method to get to folks. So I think we are making good progress. We'll continue to find people clearly on a regular basis that will need the assistance that we'll get to. As it relates to Johnson & Johnson, Clay and I and our medical team have, in fact, helped us focus where, like homebound and other populations, where getting that one shot is much more logistically sound and probably more sound for those individuals. We are using those Johnson & Johnson doses.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Last year, about this time, you were announcing the comeback plan, and then in the middle of the summer, we started getting reports that there had been a lot of cases emanating from Myrtle Beach, South Carolina. Knowing that as a history with this virus and given the variants that are out there now, what is the situation? Would there be a repeat of that situation possible with the variants and Myrtle Beach? And do you plan to do anything proactively to advise West Virginians to stay away from Myrtle Beach if it is going to be bad?
Paul, it's hard to believe, isn't it, really? It just seems like it was yesterday. I hadn't thought in any way about Myrtle Beach, but it's summer again almost, isn't it? And it's been it's been a long road for a lot of folks. And it's been a tragic road for a lot of folks. You know, at that time, I mean, there was forecasts from people out of Washington State and so on that we were going to lose 64 people in the state of West Virginia, and I was saying there's no way. There's no way. You know, that may have not been exactly at that time. You know, it may have been earlier than that, but we've lost 2,737 people in West Virginia, and all I can say is, Paul, we're going to continue to stay abreast of everything that's going on all across this country and absolutely listen to every expert. And right now, I don't really have any warnings for Myrtle Beach, but boy, what an incredible question, because gosh, you know, it's like, boy, did that ever hit home. I mean, because gosh, it's summer again. It's been a long time. Anyway, thank you.
Thanks, Paul. Next to Junaid Dill with the AP.
Hi, Governor. I think this is mostly a question for the health experts, just because it's about the dashboard. It says on the dashboard that about 69% of senior citizens have received at least one dose. Is that accurate, or am I reading something wrong here? Is that number not 79%? And as for the percentage of total doses administered, it says 86.9%. Does that include doses for pharmacies in the federal program as well? There's been some talk of in other states, the pharmacies going slower in terms of administering the doses. So I was curious. Thanks.
Thanks. And I think people are going to have to answer this question, because my update here says we've got 75% of those 65 and above with one shot, but maybe, Secretary Crouch, you can answer the questions about the dashboard stuff.
Yes, sir, Governor. Thank you. Yes, that is accurate information. Again, we're including information from the federally programs, the federal pharmacy programs and the FQHC programs. We're actually ahead of the country if you look at the totals. West Virginia has 36% of total doses administered, and the United States has 33.7%. So some of these numbers have changed. If you look again at the yellow tab, it will give you that information and give you some more definitions there that will assist you. But I think the second part of your question, trying to think what that was. Sorry, you had the question about the 69%. What was the other part of your question? I'm sorry.
I'm wondering if it's accurate that 69% of people age 65 or over have gotten at least one dose, or if that number is higher, as the governor says.
We'll have to look at that. I think the governor is accurate, and Jim may have that information in terms of the federally funded. General Hoyer, you have that information?
Yes, sir, Bill. So, Junaid, going back to your first point, the 75% that we reflect with the governor also includes the VA, and there are a couple other federal entities that are not fully reporting into the CDC data. As I mentioned last week, Tim DeBar from DHHR, 2 personnel from WVU, and our GIATA staff and Joe Peel are working with CDC. We've had great cooperation with them this week. And as to your point on the 89% number, remember too that we're calculating in their first and second doses, and second doses tend to come at the end of a week as far as those clinics of those numbers. So that's where you see that impact as well.
All right, thank you, Junaid. Governor, I'll turn it back to you.
Okay, well, thank you, everybody, especially thank our media and everything for being on with, for the PIT and the COVID briefing. And And again, please keep all these folks in your prayers. They're going through a tough time right now. You know, the 15 we lost, you know, since Wednesday, and plus all these folks that we've lost all across our state. The other thing I would promise you, or will promise you, is just this: we'll work harder at getting to those that are homebound. We've got to have the cooperation and help of the neighbors or relatives or anybody that knows of a homebound person and everything. If you'll call our hotlines and everything, we'll get there. Just help us just a little bit there, and I promise you we'll put more emphasis on that. And so I just won't have to repeat myself to the players that are on the, you know, all the experts that are on with me now. Hear me out. Let's double down and make an additional extra effort for all the homebound. I know we're doing that, but let's really bear down and get after that and try to do just a little bit better if we possibly can. But anyway, thanks to everybody. And anyway, we'll just keep at it and everything. Please wear your mask. These variants and stuff really scare me, but at the same time, we're going to get rid of these masks if we'll just go get vaccinated. That's the biggest thing we got to do right now. We talked about bridging ourselves to the vaccine. We got our vaccine and we got the supplies. Now we need you. Please go. Let me go back 1 second to just this. Parents and grandparents, please tell your kids we got to get your kids vaccinated. Help us get them vaccinated. It'll be really, really, really important. You know, we don't want to be late. We don't want to be sorry. Let's get it done. Thank y'all again.